Thank you very much for being here today. Certainly with this wind, we don't have any problem with people gathering today, I don't think. It's too cold out, but I'll try and be quick for the reporters that are here, and I appreciate you being here today. The numbers as of yesterday in Massachusetts, we had 41,199 cases of coronavirus. That was up 1,500 from the day before. Up 152 deaths, which brings our death total in Massachusetts to 1,961 people have lost their life due to the coronavirus. In Boston, we had 6,010 cases, up 261 the day before. 196 people have lost their life, 9 yesterday. And as I say every day, and I mean it every day, and as we should think every day, our prayers continue to go out to the families who lost the loved ones, and those families that are suffering from their loved ones being sick in the hospital right now. We're also praying for you and your loved one as well. We want nothing more than to protect those that we love, and if that's what drives the work we do every day to slow the spread of the virus, that's what we have to do and save lives. The good news is, and I was talking to Marty Martinez on the way down, that what we're doing is making a difference. Social distancing is working. The added care capacity is working. Hospitals are treating critically care patients with the resources they need and saving lives. And we're not overwhelming our hospital system completely. And that's because it works, and we need to keep it up. We are not at our peak yet, and the surge is going to continue. If we get complacent, we will see these numbers spike. So it's important right now more than ever to continue to be vigilant and about distancing, face covering, and cleaning. That's how we'll continue to see progress. That's how we'll get life back to normal as soon as possible. So we're asking people to please continue to remember the basics. Stay at home as much as possible, only to go out for essential items at the grocery store or the pharmacy. Wash your hands with soap and water thoroughly throughout the day. Give people at least 6 feet distance when you're walking. If you see somebody coming towards you on the sidewalk, either move to the side or cross the street. We're asking people to avoid crowds of any kind. A lot of people, and thank you for those that are doing your part. I truly appreciate it. But we're still concerned about people that aren't taking this seriously enough. I'm hearing all the time from residents who say the same thing. I got a call from a senior the other day from Dorchester. She wanted to tell me that we're doing a good job in the city of Boston, but she lives in an apartment building with people from different ages. She asked me to remind everyone, please wear a face covering when you leave your apartment, when you enter the hallway, when you go down the stairwell or an elevator of your building. She asked people to wear a face covering when you're shopping at the grocery stores. She certainly has a lot of care for a lot of people. We can't say this enough. These precautions are about protecting our most vulnerable neighbors, like our seniors and residents with chronic illnesses. The more we wear face coverings, the more effective we will be in slowing the spread of this virus. I especially want to remind everyone also who rides MBTA buses or takes trains, please, we're asking you to wear face coverings. These are crowded spaces. You owe it to yourself and to your fellow passengers to wear one. If you don't, you're putting the T drivers also at risk, so we're asking you to do that. They're putting their own health and safety on the line every single day to make sure that you get to go where you need to get to. We owe them all this right now. If we ask everyone, please do the right thing. I know that face coverings are hard to do, but it's our job, it's our duty to wear one right now. And if you don't know how to make one, we can show you how. It's easy. There's many resources available online. Visit boston.gov/coronavirus to learn more. That's probably the quickest way that you can find out how to make a face mask. I did a display yesterday. It was I had a piece of a T-shirt and 2 elastic bands, and I was able to make a face mask to show people how to do it. You might not want to do that. You might want to do something a little better than that, but please do that. It's important. I also want to take a minute to talk about our schools and how we're planning for the rest of the school year. As you know, yesterday Governor Baker announced that all school buildings will remain closed for the rest of the school year and remote learning will be continued. He also announced that child care, except for emergency facilities, will remain closed until June 29th. I certainly support the governor in this decision. It was the right thing to do. We cannot ensure the safety of our students, teachers, and staff in schools until they reopen. We've been preparing for the likelihood of this happening. The Boston Public Schools has been making plans to expand at-home learning opportunities for our kids. We'll be sharing more information about the next phase of remote learning after the April vacation. Supporting the needs of all of our students remains the top priority. We continue to operate meal pickup sites and providing Chromebooks and Wi-Fi hotspots at these sites. Every day we're distributing thousands of free meals at 65 locations across the city. We're also making home deliveries for students with severe special needs. These services are going to continue right now throughout April into school vacation week and for as long as it takes. We know that this extended closure is certainly hard on parents. You've had to step in new roles of teaching your kids and balancing other priorities, and like new work conditions, working from home. We're certainly here to support you as a city. Emergency child care programs, including nearly 40 in Boston, will continue to operate for first responders and other essential workers. You can find a full list at boston.gov/emergencychildcare. And I know the decision to keep schools closed is especially disappointing and hard for our graduating seniors. The class of 2020, we're sorry that you weren't able to have a prom, you weren't able to have senior week and graduations, at least the way that you envisioned them. But don't let this pandemic take away this moment and sense of achievement that you've had for yourself. You've worked hard these past few years and accomplished a lot. You're going to do amazing things in the future. And I want you to know that as mayor of the city of Boston and as a city, we are very proud of you. We are all proud of you. I'm sure the schools will get creative on how to mark this milestone in this time of social distancing. Even though we won't be together in person, we'll be congratulating and celebrating you in spirit. I also want to say a word to our college seniors and our entire higher education community. College are essential to our city's identity and economy. You've been in close contact throughout this crisis. Yesterday I had a call with all of the college presidents in Boston. We talked about what reopening looks like and what the campus will be. We talked about the difficulty that was to close a campus. They have to consider public health and safety measures that they haven't considered before. They have some of the most complex problems to solve. I want to thank them for pledging to work on this, do this work together. This work will provide valuable models for other sectors, and we will do all we can to support our college universities so that we can get back to some sort of normal college experience again. I just want to take a minute. There's been a lot of conversation over the last week or so about reopening and getting the economy started up again and moving forward, and certainly reopening is a top priority of all of ours. We're developing a public health criteria for what steps would be taken and when. But the fundamental requirement for public health progress is a significant increase in testing. We need to know the full picture before we take those steps. Only testing can tell us what we need to know about how this virus is affecting different parts of our community. So we're going to continue to use the resources we have to expand testing access in our neighborhoods. You can actually view our testing access map at bphc.org. I also welcome the governor's announcement today. The state will be sending testing supplies to community health centers. We have been in full partners within the state in tracing initiatives and have begun support of that work in our health centers. And I want to continue the federal government to make testing a priority. As our public health work continues, I want to ensure everyone that we'll continue to provide resources and supports that our residents need to get through this crisis. We're providing meals for everyone that needs food. Residents can visit our online map at boston.gov/COVID-19 food map to find resources near them. In housing, we've been able to halt evictions, and we're providing rental relief and mortgage payment deferral. I want to thank the governor for signing a statewide eviction moratorium bill this week, and everyone who helped get this done, especially Rep. Aaron Mikowitz from the North End and State Representative Kevin Honan from Brighton, and Senator Michael Rodrigues and the rest of this conference committee. This will provide some peace of mind for the families worried about staying in their homes right now. And I'd like to thank the leadership in the House and the Senate here in Massachusetts for their work on this. We're also supporting small businesses with grants and new resources to help them stay in business. We've increased our medical care capacity for individuals experiencing homelessness. We've added over 1,000 beds to improve spacing in our homeless shelter system and provide treatment. The Boston Hope Medical Center has treated 290 patients so far. As of yesterday, we had 169 patients, including 97 in the shelter side and 72 in the hospital side. We've added hundreds of beds for first responders and shelter staff who need to isolate from their families because of the threat of COVID-19. We're also helping many Bostonians organize and provide critical service and supports to residents. We're announcing the 4th round of funding through Boston's Resiliency Funds. We'll be distributing $1.7 million in funds to support 21 organizations in the city of Boston. So far, including this newest round, we've been able to distribute $13.8 million to 135 different organizations. As to date, we've raised over $26 million from 4,200 individuals. I want to thank you for those contributions, because those contributions are literally helping save lives. This round of support that we're about to announce is going to support community health centers, veterans, individuals experiencing homelessness, neighborhoods experiencing higher rates, and the Boston Muslim community during Ramadan, which starts tomorrow. It will also go towards personal protective equipment for our frontline and essential workers. As a city, we are not slowing down in our response. We approach every day with a new sense of urgency, because every single day counts. To our first responders, our medical professionals, and all the essential workers who are doing important work every single day, we can't thank you enough. I want to thank our public employees who have not stopped serving the people of Boston despite everything they are dealing with in their families as well. Our public works employees who are making sure that trash and recycling gets picked up on time. Our transportation department employees who are keeping our streets safe and accessible for healthcare workers. Our parks employees who are maintaining our open spaces. Our custodians who continue to clean City Hall and all of our municipal buildings. Our 311 call takers answering residents' questions. Our 911 dispatchers connecting them to life-saving help. They're keeping our city running in these extraordinary times. I want to thank everyone who's practicing social distancing to help us slow the spread of this virus. It's hard to be apart from those that we love when we need them the most, but in many ways we've been able to connect more deeply in these difficult times. Bostonians continue to come together in extraordinary ways. All over the country, people are coming together. They're finding new ways to connect with one another, and they're creating community, as we have always done in hard times. But I was upset the other day when I heard the president wanted to suspend immigration in the United States. This would do nothing to protect people from the coronavirus, and certainly do nothing to protect our economy. It was a foolish policy, only to distract people from the real issue at hand. Our immigrants need and deserve support. They're on the front lines of fighting the coronavirus. They're health aides, nurses, physicians, and surgeons. And I know I said this before, but I want to just repeat it again. They're essential work to our food industry. In Boston alone, 46% of accommodations and food workers are foreign-born, with close to 25% of our country's undocumented population working in these industries. And despite nearly 26% of our city workforce, immigrants make up 35% of our healthcare workers, 35% of our healthcare workers, 40% of our construction workers, 41% of our hospitality workers. Boston and the region's economy depends on immigrants. Making sure our immigrant workforce is healthy and financially stable during this pandemic will help our economy recover and efforts happen more quickly. In Boston, we will continue to stand with our immigrant communities no matter what. We are one Boston community that looks out for one another. As I mentioned, Ramadan starts tomorrow night. It's another important month for the Muslim community. Each year here in the city of Boston, we host a community iftar at City Hall to celebrate. We can't come together this year, but I want our Muslim neighbors and colleagues and friends to know that you have my support. I'm very grateful to the leadership of your mosques and communities for planning virtual services that keep everyone safe and healthy. When I see every religion and secular community that is physically distancing itself in an act of faith and love for our elders, for our vulnerable neighbors, for our frontline workers, first responders, for everyone, I want to thank you for that. So I want to wish everyone who observes a blessed Ramadan. We all stand together as a one Boston community, united by our values, our care for each other, and our resilience. That's how we're going to get through this very difficult time and come out stronger on the other side. I have a few questions here that I'd like to, before I open up for questions here, to the reporters that I received from other reporters from the Boston.com. What would need to happen between now and September for the marathon to go on as planned with the normal number of runners and fans, and how confident is the mayor that will actually happen? I certainly saw that the Berlin canceled their marathon this September today. They canceled it today. To be honest, we haven't had those conversations yet. We started talking about what's going to happen in the next few months and what Boston's going to look like. I'm sure that the marathon will be part of the conversation. I am hopeful that we'll be able to have the marathon, because certainly I felt on Monday there was a void in the city of Boston. But we will have more conversations and discussions. And again, it goes back to testing. If we have the numbers and we can see the data, we'll be able to make more informed decisions. A question from Danny McDonald, the Boston Globe. You've said there's no timeline for reopening Boston, but what would he say to the people who have significant life events like getting married, or holding a traditional funeral, or putting off? Should they be ready to wait indefinitely? I know this is a hard time for many people. Students are losing out on their education and graduation celebrations. People are losing out on work. Too many are not able to say proper goodbye to their loved ones. I have a friend whose mother died, and the conversation that he's having with his siblings is about how do you celebrate their mother's life in these times. Everyone is doing their part by staying home, social distancing, washing their hands, and wearing face coverings. We'll get through this together. We'll get back to things that we love and enjoy. Reopening needs to be done very carefully, and we need to start those conversations now to prepare what that looks like. Question from the Business Journal. Mayor Walsh said last week in this talk to the Chamber of Commerce, you mentioned that you were planning to speak with construction officials about reopening of construction. What would that look like across the city? Have you had those conversations? First question. Second one, who did you speak with, and when would you expect a slow ramp up in construction? Last Friday, we issued a draft state safety policy for construction that's designed to make job sites safer for workers and communities. This policy must be implemented for any essential construction by Monday, and any permanent construction will be required to sign a safety affidavit. This does not change work that is currently allowed in Boston. I released a video also describing the safety protocols last week for construction workers and guidelines that are posted on boston.gov. So we don't have an actual confirmed date, but we will be talking about that in the coming weeks. A question from the Bloomberg News. We know the critical importance of increasing testing. What new efforts are being done in Boston to increase testing? Is there any efforts to increase antibody testing in Boston to get more accurate picture of the infection rates? I'm going to ask Marty Martinez to address those. Did you have a question? So last page.
Yeah, so the question's related to testing expansion, and so we're working to both expand diagnostic testing in each of our neighborhoods through our community health centers and the support we've gotten through the Resiliency Fund, while partnering to lift up the amount of people that are being tested across the city. That's an important effort that we need to be able to do to make sure we have a good understanding of the infection rate, as the mayor has spoken of. And we're also working on antibody testing as well, exploring that in partnership with the state to be able to see how we can bring antibody testing to a targeted population here in the community. As the mayor said, widespread testing is necessary to understand the true infection rate, so we can really understand where it's been and how we're making sure people get the care they need. So we're exploring both paths to expand testing in the city.
Thank you, Marty. Any other questions? The question is, with daycares closed right now until the end of June, per the governor yesterday, is it likely that the city of Boston will be closed the same timeline? I think it's hard to say yes to that question, but it's not unrealistic right now. I think it's still too early to talk about when do we start thinking about reopening the city. And I think when we talk about reopening the city, you know, there's a couple ways of looking at it. One is how do we reopen City Hall, and the other is how do you kind of go back to society. As I said the other day, it's not a flip of a switch and the lights come on, there you go. It's going to be a slow ramp up, I think, in a lot of different industries across the city of Boston, across the state, and across the country. And I think that many people are having those conversations right now about what it looks like. But I just don't want to lose sight of the work that's still in front of us, of continuing to stop the spread of the virus. But as you know, as we get into the next coming weeks, there'll be a lot more conversation at this podium and other places about what it looks like and how do we look like going back to work. To answer your full question, I think that certainly if we went back as a society prior to June 29th, we'd have to make some adjustments to the child care because families don't have the ability to take care of their children and go to work at the same time if they have to work at work. Any other questions? Yeah.
So I know we did ask you
The question is talk a little more expansively about small businesses and the effects of potentially being closed for a longer period of time, and then tourism in the city of Boston. Certainly with the small businesses, the United States Senate took a vote yesterday, $450 billion, another package, $311 billion of that's going to go to small businesses, and I hope that the federal government does a better job this time of distributing it to actual small businesses and not to chains that have resources and money. And we're going to be pushing our congressional delegation to make sure they push the federal government to get this money to the business that need it. The last fund ran out. So I think, when it comes to businesses, I think that, our Office of Economic Development, we have small business resource and guidelines, and I think a lot of businesses are going to have to examine what they are when they come back. And are they a different type of opportunity, or do they have a different structure than when we came into the coronavirus? I think now is probably the time that they're going to have to make many difficult decisions on what their company looks like. Do they downsize? Do they scale back? Do they open up? I think all those questions we can help businesses here at the city through our Small Business Office Economic Development. On the tourism front, certainly, I think about it this weekend. Today would have been a day that Faneuil Hall would have been loaded with marathon jackets. People generally come in for the marathon from all over the world. They come to the city, they spend a week here, they spend a lot of money here, they buy gifts, they buy stuff, and they go back home, they stay in our hotels and eat in our restaurants. And looking out the window today is strange. It's the first Marathon Monday since I've been mayor, or the couple days after the marathon that I've been mayor, that I don't look out. I watch the jackets the day after the marathon, and I watch Tuesday, Wednesday, Thursday, and then Friday they start to disappear where a new group of tourists come in. So certainly the impact's going to be deep. They're going to be deep here in the city. They're going to be deep at the state, and they're going to affect our tax revenue, and our businesses are losing out on that this week as well. So I do have concerns about tourism. When does that come back? Even if we open society up, I don't see tourism coming back for months, if not a year or so. I think a lot of people are going to be concerned about flying. I think a lot of people are concerned about traveling to other places. So I have major concerns about our tourism industry, absolutely, at least in the short term. All right, everyone, thank you. Thank you.